Bismillahirrahmanirrahim. Now we will discuss the Sjogren syndrome. So Sjogren syndrome के अंदर बेसिकली एक autoimmune inflammatory disorder है which is characterized by the lymphocytic inflammation, the lymphocytic infiltration and destruction of the lacrimal glands and the salivary glands and some other exocrine glands as well, exocrine organs as well. Classical triad, dry eyes, dry mouth, and the parotid gland enlargement. So we can see the pictures. There is first one is the histology of the lacrimal gland, which is infiltrated by many lymphocytes. Second one is the dry tongue with the cracks on it, in the fissured tongue, and the third one is the parotid enlargement. You can see here parotid enlargement. So this is the triad of the Sjogren syndrome. So, Sjogren syndrome is associated with the rheumatoid arthritis and systemic lupus erythematosus. SLE, if it is secondarily, or if it is primary, it can exist in isolation as well. Primary Sjogren syndrome affects the females more frequently than the males, and criteria for diagnosis in patients with a clinical picture suggestive of Sjogren syndrome involve the positive for anti-Sjogren syndrome A and anti-SSB antibodies, or positive rheumatoid factor together with significantly positive ANA rheumatoid factor, SSB, SSA antibodies. Ocular surface staining above a certain rate, and the lymphocytic sialadenitis to a specified extent on the salivary gland biopsy. So these are the three criteria mainly for according to the American College of Rheumatology criteria. So treatment options involve a wide range involving the treatment required for the dry mouth and like salivary stimulants, the oral pilocarpine, and in some cases immunosuppression and biological markers like rituximab can be used. Clinical features: how the patient can present to the can present. He or she can say, I have dryness, grittiness, burning sensation in my eyes over a course of the day, and sometimes there can be stringy discharge, redness, blurring of the vision, and crusting of the lids are also common. So symptoms associated, what is the tip? Symptoms associated with the KCS, that is keratoconjunctivitis sicca, are exacerbated by the exposure to the wind, air conditioning, and the central heating. So these three things exacerbate the symptoms. Conjunctiva, KCS means keratoconjunctivitis sicca, विंड की वजह से, एसी की वजह से, या फिर हीटर की वजह से. So how ophthalmologist will find out that it is the dry eye disease, that is keratoconjunctivitis. It is a dry eye disease caused by inflammatory disorder, autoimmune disorder, that is Sjogren. He or she will see the signs, that is posterior seborrheic blepharitis with meibomian gland dysfunction is also present. Conjunctiva, there is redness. Staining with the rose bengal. Staining with the rose bengal and lissamine green stain. Staining with the rose bengal and lissamine green stain. So these are the pictures above. 5.4a is showing with the rose bengal, and 5.4b will show the lissamine green stain, conjunctival staining in the dry eye. So there will be keratinization as well. They can be conjunctivochalasis. That is a common response to chronic irritation of the dry eye. It is commonly occurring in ocular surface diseases. So this is all about the conjunctiva. That it will be red, stain will be positive. Conjunctival stain for rose bengal, and the lissamine green stain will be positive. There can be keratinization on the conjunctiva. There can be conjunctivochalasis. So tear film, normal tear film breaks down and the mucus layer becomes contaminated with the lipid when it is washed away. However, in dry eye, जो लिपिड कंटेमिनेटेड म्यूसिन है वॉश अवे नहीं होते, बल्कि पार्टिकल्स और डेब्रिस बन के मूव करते रहते हैं ईच ब्लिंक पर. मार्जिनल टीयर में निस्कस भी देख सकते हैं, वो क्रूड मेजर है. Marginal tear strip भी देख सकते हैं. It is a crude measure of the volume of the aqueous in the tear film. In the normal eye, meniscus is 0.2 to 0.4, whereas it is reduced to 0.25 millimeter or is absent in the tear film in case of Sjogren syndrome. Cornea show the punctate epithelial erosions. Filaments consist of strands of mucus and debris, and there are also mucus plaques. with similar constituents may occur in the severe dry eye. They are mucous plaques are semi-transparent, whitish in color, often slightly elevated. Complications can be vision-threatening, epithelial breakdown, melting, perforation, bacterial keratitis. So, tip: patient with symptomatic dry eye disease manifests with superficial punctate keratitis, which can be seen clinical with fluorescein staining. So, an ophthalmologist will see that there will be posterior blepharitis, then can be signs of conjunctiva that will stain positive with the Laysamin green and the rose bengal. इसके अलावा there can be keratinization. Then when he or she will observe the tear film, there will be reduced tear film meniscus, and there will be mucus plaques accumulated, and debris will present on the mucin layer. There can be punctate epithelial erosions. In case of cornea and filaments can be seen, mucus plaques can be seen. Complications can also occur. Investigations